Welcome back to the channel, and if you're new here, my name is Renee Serbon. June is Acne Awareness Month, and this is the perfect time to have a very honest conversation about how our industry treats acne. Because frankly, the standard acne protocol is broken. We are often taught to strip the oil, kill the bacteria, and aggressively exfoliate the surface. But what if the approach is actually making our client's skin worse? Today, we are going to look at why the traditional acne model fails and how shifting to a barrier-first approach absolutely changes everything. For decades, acne treatment has focused almost entirely on the symptom, the breakout, the congestion, the oil, and the bacteria. So the logical treatment became to remove the oil, destroy the bacteria, dry the lesion, and exfoliate the surface of the skin. But that is just symptom management. It is not barrier correction and does not give long-term results. When we treat only visible symptoms without understanding why the skin is inflamed, dehydrated, and reactive in the first place, we often create the exact condition that allow the acne to continue. The traditional model says focus on oil, bacteria, and breakouts, then strip, dry, and exfoliate. But the result is often barrier disruption, more moisture loss, more irritation, easier penetration of irritants into the skin, more inflammation, and more breakouts. Here's what the problem is. When you aggressively strip the skin using high-strength salicylic acid, benzoyl peroxide, harsh scrubs, or repeated exfoliation or peels, you are not just removing excess sebum, you are actually dismantling the skin's primary defense system, the stratum corneum. The skin barrier is made up of corneocytes that are held together by a lipid matrix, primarily made up of ceramides, cholesterol, and free fatty acids. Now, when we use these stripping agents repeatedly, you deplete those essential lipids. And once the lipid matrix is compromised, the skin can no longer regulate water loss properly. This is where the vicious cycle begins. Harsh actives strip the lipids. The lipid barrier becomes weaker. Transepidermal water loss absolutely increases as an end result, and the skin becomes, therefore, more dehydrated. And because the skin is intelligent, it senses that it is losing water and that its barrier has become weak. So what does it do in return? It signals the sebaceous gland to produce more oil in an attempt to protect itself. Now the practitioner sees more oil and more congestion, so they treat the skin harder in return. The client becomes more dehydrated, more inflamed, more reactive, and the acne worsens. This is why I always say you cannot heal an inflammatory condition by inducing more inflammation. Now let's talk about the bacteria itself. Cutibacterium acnes, formerly known as Propionibacterium acnes, is often positioned as the enemy. But C. acnes is not automatically the villain in this case. It is a normal commensal organism and part of the skin's microbiome if it is where it's meant to be. It only becomes problematic when the environment changes, specifically when there is a lack of oxygen inside, a blocked follicle, excess sebum, altered keratinization, and a compromised barrier environment. So ultimately, when we destroy the barrier in the name of acne treatment, we are also not creating a healthier skin. We are in fact changing the terrain. This is a reframe. C. acnes is a normal resident of the microbiome. The problem is not simply the organism itself. The problem is the environment. When the microbiome is balanced, sebum production is regulated, the barrier is intact, and the immune system is not constantly activated. However, When the follicular environment shifts, low oxygen, excess sebum, blocked follicles, barrier disruption, and immune activation, the entire system changes in the skin. That altered environment allows inflammation to build, and that inflammation is what drives the visible acne pattern. Redness, swelling, tenderness, congestion, and breakouts. So instead of asking how do we kill the bacteria, we need to ask a better clinical question. What environment is allowing this inflammatory acne pattern to continue? So how do we fix this? We have to stop treating only the symptom and start treating the structure itself. We need to move away from a seek and destroy mentality and move towards protect and repair methodology. That is the corneotherapeutic approach. Before you try to extract every comedone, prescribe a harsh peel, or overload the skin with aggressive actives, you must rebuild the lipid bilayer. You need to replenish what the skin is actually missing: ceramides, free fatty acids, cholesterol. Because the clearer, calmer skin we want depends on the barrier being able to function optimally. This is the barrier first approach. Stop stripping the skin, start restoring, replenish the lipids, reduce that transepidermal water loss, and calm inflammation. We want to stabilize the microbiome in the end, and when the barrier is restored, the skin is no longer in panic mode. It does not need to overproduce oil to compensate for that dehydration, and it also becomes less reactive. The inflammatory response begins to settle, and very often the acne begins to improve because the skin is finally functioning correctly. Barrier stability changes everything, especially in an acneic skin. It is the prerequisite for a clean and clear skin. As practitioners, our goal is not simply to give the client clear skin for a week. Our goal is to help them build resilient, healthy skin that functions optimally for the long term. And that starts with respecting the barrier. If you are a skin professional and you want to deepen your understanding of these mechanisms, not just memorize the protocols, then this is exactly the type of thinking that we develop inside my Professional Skin Assessment Mastery course. We look at what is happening in the skin, why it is happening, and how to build a treatment strategy that supports the biology instead of fighting against it. Thank you guys so much for watching. Please like, subscribe, and share this with a colleague who still thinks acne treatment should start with stripping the skin, and I will see you next week.